Welcome to Board Prep Cardiology Batch 4. Today I'll share 20 questions with you. I recommend that you pause the video after each question and provide the answer. In doing so, you're evaluating how much you really know. Let's begin. Name the preferred medication to treat ventricular tachycardia. Amiodarone. Name the preferred medication to treat supraventricular tachycardia. Adenosine. What is the preferred treatment for the cardiac patient who is hemodynamically unstable? Synchronized cardioversion. Name the most common cause of ventricular fibrillation. Ischemic heart disease. A patient came with progressive prolongation of the PR interval on the ECG with a sudden dropped QRS complex. What does this patient have? Second degree AV block Mobitz type 1. A patient presents with normal PR interval and sudden failure of the P wave to conduct on the ECG. What does this represent? Second degree AV block Mobitz type 2. Which is the most common type of cardiomyopathy? Dilated cardiomyopathy. Which abnormal heart sound is associated with dilated cardiomyopathy? S3. Which is the best test to diagnose dilated cardiomyopathy? Echocardiography. Which is the most common cause of hypertrophic cardiomyopathy? Hereditary. It is an autosomal dominant disorder. Which cardiomyopathy presents with dyspnea on exertion, syncope on exertion, and sudden death in young athletes? Hypertrophic cardiomyopathy. The systolic ejection murmur associated with hypertrophic cardiomyopathy is decreased by which physical action? It is decreased by squatting, lying supine, and straight leg raise. The systolic ejection murmur associated with hypertrophic cardiomyopathy is increased by which physical activities? It is increased by Valsalva maneuver and standing. How does hand grip affect the murmur associated with hypertrophic cardiomyopathy? The murmur decreases with hand grip. Squatting increases the intensity of all murmurs except two. Which two murmurs are not increased by squatting? Mitral valve prolapse and hypertrophic cardiomyopathy. Which is the drug of choice for patients with symptomatic hypertrophic cardiomyopathy? Carvedilol, which is a beta blocker. Bright sparkling myometrium is noted on the echocardiogram. Which cardiomyopathy does this represent? This represents restrictive cardiomyopathy. Which physical maneuver improves the pain of acute pericarditis? Sitting up and leaning forward. Which ECG finding is suggestive of acute pericarditis? Diffuse PR depression. Well, thanks for watching. Remember, the brain uses repetition to enhance recall. Concentrate on each item and you will be amazed how much your memory have improved. Please don't forget to like, share, and subscribe. I wish you well. Good night.